I'm the head of project for WHH Focus-Based Action Project. The project is an early warning, early action project where we're trying to develop a drought mitigation system. So the project is trying to avert or at least minimize the negative impacts of a drought on selected communities who are vulnerable. Differentiating our approach to the traditional approach where we are saying response will come well after a disaster strike. So the proactiveness is coming when we are looking at activating early actions well in advance within a specified window of opportunity, a definite time frame, so that our communities are assisted well in advance before a disaster strike. And we're doing it in 3 districts as pilot districts, which are Chimanimani, Chivi, and Matobo. The system, our drought mitigation mechanism, indicated that there was a drought in all the 3 districts, and the system triggered and activated the early action protocols. So we're now in the process of trying to implement those identified early action protocols in all the 3 districts.
In our DRR plans, what we have, or plans that we've listed, is potential hazards for Chivi, disasters, etc. You'd find that one of the issues that top the list is the issue of drought. So the project came in with issues of addressing some of those immediate challenges that we had.
I'm the programs head with Action Against Hunger in Zimbabwe. We are working across several provinces, working on the following thematic areas: food security, livelihoods, wash, health, among the different programs that we are doing. And particularly in Chivi district, we are working with our local partner, that's Nutrition Action Zimbabwe, implementing this early action protocol development project. The project seeks to work with the communities. It's a community-led process where communities identify the different hazards that are affecting them, particularly drought. They develop early actions, hence the early action protocols, and then looking at the different modalities and ways those early actions are implemented. One important thing about this project or this approach is it puts the affected populations at the center of program design. It looks at a bottom-to-up approach, which is unlike the traditional programming. Hence, it's very, very important. It's grounded within the community, and it also seeks to have long-term sustainability, bring the different stakeholders together, and most importantly, the communities at the center of programming.
We are engaging since a couple of years now in this anticipatory action approach, and we really found our heart in there. We really think it's a good thing to invest further, and we really want to invest further into it. We can detect, we can predict most of the disasters, and if we take action, we can really avoid loss and damages, we can avoid loss in livelihoods at the first place.
What brings us here today is because of issues that do with climate change and that do with the environments that we come from. We are talking about the marginalized areas where we do get less of the rainfall per given time, and bringing these ideas together. I was going around and I did see there is a lot that is being done, but all is being done in the name of focused-based action. Our thrust is to help the rural folk to come out of poverty by making sure that we plan accordingly.
My name is Chimanimani Washaya. I'm a disaster risk reduction and focus-based assistant in Chivi district. I am from Nutrition Action Zimbabwe. We are working in partnership with the ACF Action Against Hunger. We are being funded this project of focus-based project and the election protocols by WHH. We had key informants interviews. We also did focus group discussions, and during the focus group discussions, people were grouped into clusters of women, men, youths, community leaders, so that people will be able to express their feelings and the impacts of drought in Chivi district. We also used the questionnaires to collect qualitative data for the drought impacts in Chivi district. We had 438 respondents, 72 questionnaires were dispersed to the community. stakeholders, 43 for the FDGs and 29 for the key informants. And respondents were requested to identify and rank their early action protocols. And the final ranking, which was identified as the most early action protocol to reduce the impact of drought in Chivi, was cash transfer.
My name is Chivi, representing Caritas in the Archdiocese of Bulawayo, where we are mostly working in the Matobo province, with much of our presence being in Matobo district, where we are implementing various livelihoods to help the people of Matobo to eradicate drought, issues of hunger and malnutrition, and also helping people to be able to be resilient when they face natural disasters. And currently in this FPA project, we are working together with Tsuro, with funding currently coming through the START network, where we are going to be able to assist 2,000 people in the wards of Matobo district, that is Ward 1 and Ward 2, by distributing a food hamper that will allow people to have a good dietary for their current. We're going to assist them for 3 months, from July, August, and up to September.